tonight we're going to talk about oxygen. Oxygen is considered the essential nutrient. Now, usually in this TV show, we're not talking about a specific treatment like oxygen. Usually we're talking about a specific disease or problem like allergies or like autism. But tonight we're going to talk about a treatment that applies to a lot of different problems. With acute oxygen deprivation, it's very clear. You can't live more than 3 or 4 minutes without oxygen, or else you get pretty severe brain damage. And after about 4 minutes, you don't really want to wake up unless you've been in freezing cold water, and then your brain might survive longer. But you're going to be brain damaged after about 3 to 4 minutes. But what we're dealing with today is either a low-level chronic deficiency of oxygen delivery to the cells, or we're talking about damaged tissues that aren't getting enough oxygen supplied, or that have a higher need for oxygen. So we're going to look at how we can deliver that oxygen to them in an efficient manner that promotes healing. If we take people and just have them breathe oxygen, that works really well if they're starting off low in oxygen. So if you have a lung problem or asthma, or if you're undergoing surgery, then breathing oxygen for short periods of time is a good idea. However, it doesn't deliver a whole lot more oxygen to your tissues. It will deliver the oxygen to your lungs, so it will reverse some deficit you might have there. So if you're starting off low in oxygen, breathing oxygen is a great plan. But if you're starting off normal, then your red blood cells in your bloodstream are already 98% to 99% saturated with oxygen. And breathing more oxygen is not going to raise your tissue delivery of oxygen a whole lot. This next slide shows what happens to our oxygen as you go from the lungs to the arteries, to the heart, to the peripheral arteries, to the organ capillaries, to the cells, and then to the mitochondria, which are the subcellular organelles that create your energy. And you start off with 160 millimeters of mercury. It's the way they measure the pressure of oxygen in the air. But by the time you get down to the cell, you're only at 1 to 10 millimeters of mercury. And by the time you get to the mitochondria, you're down to about 0.5 or a half of a millimeter of mercury pressure of oxygen. Now, since the mitochondria create your energy, it's not surprising that you're going to have a hard time healing or growing protein, muscle, bone, whatever it is you need to grow if you're having an oxygen deprivation problem, including lack of blood flow. Studies show that a lot of different conditions, including strokes, heart attacks, cerebral palsy, autism, chronic viral infections, actually have either a lack of blood flow or a lack of oxygen delivery or utilization at the tissue level. So a lot of these states we deal with are dealing with chronic low-level oxygen deprivation problems or a need for higher oxygen levels in order to return to normal function. There's a number of reasons why people can be affected with low oxygen tissue states, head injury, surgical wounds, skin grafting, plastic surgery, severed limbs that have been reattached. Radiation therapy is a common cause of tissue damage. Severe burns, carbon monoxide poisoning. We talked about heart attacks, strokes. Really, all these things can cause problems. So what are we going to do to get more oxygen? Well, we're going to put it under pressure. We're going to put somebody in a chamber that's a dive chamber. Most people have heard about this as far as deep sea divers treating the bends. If a person is submerged in the ocean, then they're under pressure, and that puts the nitrogen in their joint fluids. It dissolves more nitrogen in that fluid. If they come up too much, too fast, from the deep sea pressure, then that nitrogen comes out of solution, and you get little bubbles forming in the joints, and that causes extreme pain called the bends. So the hyperbaric part of hyperbaric oxygen therapy means increased pressure. That's all that means, is greater than atmospheric pressure. Henry's law is a law that talks about how many molecules of gas, like oxygen or nitrogen, can be dissolved in a liquid. And that has to do with the pressure. The more pressure you put a solution under, it's like we had a beaker right here that was half filled with liquid and half filled with gas, and we put pressure into that beaker, then more of the gas would dissolve into the liquid. And what this shows is a very nice illustration of how if you just breathe oxygen, all that happens is you carry more oxygen, a little bit more oxygen in your serum and plasma, and then a little bit more on your red blood cells. But if you put people under pressure, then a lot more oxygen actually dissolves in the plasma and in the serum of your bloodstream. If you're saturating your plasma or serum with oxygen, little microscopic, not really bubbles, but molecules in there, then that can get directly to the tissues. And it's been shown to raise that pressure of oxygen in the mitochondria, which makes your energy, and lets the cell do whatever it's supposed to do, from 0.5 up to maybe 3 or 4. Even with the low-tech, low-pressure chambers we'll talk about, it can double it. So from 0.5 to 1. And that's a huge difference in your ability to function at the cellular level. There was a 5-story hospital built in Cleveland, Ohio, and the entire thing was a hyperbaric chamber. So when you walked in the front door, you went through a compression chamber, and the entire hospital was kept under pressure so that people would heal better. So this then crashed with the Great Depression, but there was this hospital that ran for several years called the Timken tank, because H.H. Timken was a stock millionaire, a tycoon, who commissioned this Dr. Cunningham to build this hospital because the evidence, even in the 1920s, was very strong, supporting the effects of hyperbaric oxygen in healing both acute and chronic wounds. And the therapeutic principle is that, of course, it dramatically increases the partial pressure of oxygen in the tissues, and especially in the mitochondria. And that provides immediate support to tissues that are not being perfused, like an acute heart attack or acute stroke, and have compromised blood flow. And then also chronic problems such as unhealing wounds. It also creates angiogenesis, which means the creation of new blood vessels. So particularly in wounds, you'll see if you biopsy these wound edges that a wound that's been stagnant for months or even years, when the people start going in hyperbaric treatment, will have new blood vessels growing into the wound to help heal it. And part of that is the different chemical factors, microhormonal factors that are created in the tissue in response to the increased oxygen and pressure. And part of it is actually your stem cells. So the types of hyperbaric usage. Some conditions are better served with immediate usage, like an acute stroke or acute head injury, an acute heart attack. There's the ongoing usages when any of those disorders become chronic after the fact, or chronic things like autism, Lyme disease, multiple sclerosis, and then temporary uses like surgery, wound healing, sports injury, and plastic surgery. So here's some facilities where you can find hyperbaric treatment near you. If you're not around here in Nashville, you can go to the International Hyperbaric Association. You can go to the Underseas Hyperbaric Medical Society. They're the more conservative society that only believe in the 13 Medicare-approved diagnoses. And you can go to HBOT.com for some more liberal and also some HBOevidence.com to see some of the evidence behind that. So thank you very much for joining us on Future Doc, the TV show. I'm Dr. James Biddle. Today we're talking about hyperbaric oxygen therapy and its treatments, especially for off-label uses. And I hope this is helpful for you and your family to restore and regain optimal health for the rest of your lives. Take care.